Go ahead. Okay, so we're live at COVID-19. Please tell us what's going on.
Right. So my aunt came to visit us last week on Wednesday, and she had a little fever that day. So we checked. Maybe the next day I checked the fever. It was 99.1, and it subsided in a day or two, not more than that. And after that, I think only yesterday, day before yesterday, she couldn't smell anything, like not even hing, which is a very strong smell. So that, got us worried. So we got her tested yesterday, and she was tested COVID positive.
How young is she?
She's 68.
Okay, years of age. All right. And she has issues with COVID-19 positive. And when did the symptoms start? Give me, when did they start exactly? A few days ago, 2 days ago?
Yeah, she didn't smell anything 3 days ago, but I think we like last Wednesday she had fever, like very slight fever, not like high fever.
Okay. And how is she doing now? Is she, what is she doing
Well,
now?
she doesn't have any symptoms as such right now, but she couldn't smell literally anything.
Okay, and how about her taste? Her taste is also changed?
Yeah, taste is there. She can taste, yeah, whatever food she's eating, she can taste that. So no numbness or anything like that.
Okay. So as far as what's her, do we have a pulse ox and a blood pressure on her?
No, we haven't. I'm trying to get one oximeter to check her oxygen saturation levels. So we haven't checked that yet, but it's supposed to come today or tomorrow.
Okay, got it. And then in addition to that, does she have any medications she's taking currently?
Yes, she has a pacemaker, so takes, she takes medicines for that. I think it's for her heart. Yeah, some Rosavac or something like that.
Can you give me those medications, Mataji? I need them.
Yes, just a moment.
And just to let you know, this is Mrinmoy. She's our medical assistant, so at the hospital down here. So.
All right, that's good. Just a second. Can I mute it for a moment?
Yeah, go ahead. I'll mute myself. That sounds good. All right, go ahead.
Yes, Prabhu. Okay, so she's taking rosuvastatin, clopidogrel, then Tazoloc 40. I don't know the composition of that, and a calcium tablet, and a Flavidone.
Trazodone? For sleep?
Tazloc, Tazloc, Tazloc 40.
40. Let me look that up. I don't know. I think I need to find out what the generic for that is. 1 second.
Yeah, it's like a combination. There is an amlodipine.
Okay, that's a blood pressure medication. Okay, let's go through them a little slower. Let's go through the statin. You said she's on atorvastatin. What kind of statin is she on?
Rosuvastatin, clopidogrel.
Okay, got it.
Yeah.
That's like the best statin that's out there.
Yeah, and she's also taking azithromycin.
Right. Why is she on the azithromycin? Because of the COVID.
Yeah, because of the
and
COVID.
She's on, is she taking
Sorry?
vitamin C, D, vitamin E?
Yeah, she's taking vitamin C and zinc.
And zinc. Okay.
Zinc and vitamin C. Yeah.
Zinc. All right. And then what else is she taking?
That's it. And did I say calcium and a tablet called Flavidone?
Flavidone with a F, Flavidone.
Vedon. Flavedon.
Let me just look that one up. Flavidone. Flavidone. Anti-anginal, so anti-chest pain medication. What is the? It's a beta blocker. Does she have any asthma or anything like that?
No, she doesn't have any asthma. No. No.
Any history of smoking or anything like that?
No.
So she couldn't smell now for the last 2-3 days, and she's been really this. And then when did she come visit? When did she travel? What were the days that she traveled?
Actually, a month back, she was staying with us for almost a year. Then a month back, she went back to her place, which is also in Calcutta. And then for a month, she used to go to the shops, to buy vegetables and stuff. She went to the bank, and she had her mask on most of the times, but sometimes she forgot. But never sanitized her hand after handling currency, money and everything. So, yeah, that happened for a month. And then last Wednesday, she was back with us. And then she had fever. Last Wednesday was the first day she had a fever. And it subsided after a couple of days.
And you have a baby in the house, correct?
Sorry?
There's a baby in the house, right?
Yes, he's 4 months, 3 weeks.
Yeah, so
and also
I agree.
Diabetic.
Go ahead.
Also, my mom is there and she's diabetic.
Okay. Okay, so make sure you just separate her from mom for sure. Make sure that there's a lot of distance that's there. Like they're in separate rooms. Is that possible?
Yeah, she is in a separate room with a separate bathroom.
Good. That's for number one. Number two is just breathing wise. Is she having any trouble breathing?
No, not yet.
Okay. So she may not feel comfortable coming on camera right now. What we can do is we can take it off live and then I can see her right now. But how can you do it? I know that.
Yeah,
is that even possible?
It's possible if you see her from a distance.
Okay, that's fine. Is she okay with coming on camera?
Yeah, I think she should be fine. Yeah.
On live stream, okay. Yeah, you need to wear a mask, Mataji. That's not going to help. Do you see what you're doing across your face? That's just covering your face. All right, good. That mask is better. So if you just from a distance, you just show from a distance. Don't go too close
No.
because of course, okay, don't go too close. Just, I mean, all I need to do is I just need to evaluate her. So just turn the phone and so
Sorry.
I can see her. Oh,
Yeah,
she's on the phone.
yeah,
I
there
just
she,
saw that she's on the phone. She's standing. All
yeah.
right. Can she be able to breathe well? Is she breathing okay?
নিঃশ্বাস নিতে পারছো? Yeah, she can.
Can she walk? Can she walk first? Obviously, she walked there.
এটা-
Can she walk back and forth? Good.
Yeah.
Okay, turn around, go back, go back, go back, go back. She should, when you come in the room, she should wear a mask. Okay, so just relax.
Okay.
Okay, so
Mask
she
পরে
should
থাকতে
wear,
হচ্ছে।
you should wear a mask.
Right, yeah.
And then she needs, also you should be wearing goggles if you're gonna go in the room.
Oh, okay. We don't have goggles.
I want
But
you
we
to
can.
just wear glasses. Can you
All
get
right.
glasses?
Yeah,
Glasses are better.
okay.
Yeah,
So
yeah.
yeah, there's
Yeah.
a face
And
shield
then,
available. Maybe we can use that one, can we?
and then, okay, so she's not having any problems breathing. Koi saas ka problem to nahi hai, Mataji? Can you ask her in Bengali?
কোন problem আছে? No, she's not having any breathing problem.
All right. And she's saying that is her taste or smell, is it getting better?
Taste পাচ্ছো খাবারের?
হ্যাঁ, টেস্ট পাচ্ছি, কত পাচ্ছি।
No, she's no difference whatsoever with the smell, but she can taste her food.
She having a headache?
মাথা ব্যথা আছে? Nope. No
Can you get a
headache.
blood pressure? Just get a blood pressure and a saturation for me and text me on the group. And then we'll
All
go
right.
from there.
Yeah, once we
Okay.
get that name, we'll check it.
Right now, and how about at night? Is she having any trouble breathing at night? Any even
রাত্রেবেলা
even
নিঃশ্বাস নিতে হচ্ছে? No.
good. Okay. All right. So just keep the social distance going. Make sure you wash your hands, sanitize everything, and then go from there. I know that pediatric cases, there's really not that much literature saying that your 4-month-old is at risk, but let's just be extra super careful.
Sure, yeah.
Where you're wearing a face mask and goggles and all this stuff, and then you wash really well. Now that you've gone in the room, you wash your hands and feet and everything like that really well before you pick up the baby. And then for
Right.
mom, I don't think there's a reason for mom to even go in. She has diabetes, right? So if mom
Yes.
has diabetes, there's no reason for her for the next week to even meet her. If you guys want to meet, you guys can talk on the phone.
Yeah, but actually we have to give her food. So food and
Oh,
water all the time. So she has a plate that she just slides outside the door and my mom puts the food in and then she takes it in.
That's fine. That's absolutely fine. That's good. Just give it a week. And then I think, she sounds like she's on the recovery phase anyways. Doesn't sound like she has any fever. What's her temperature? What's her last temperature?
Last temperature was, almost 5 days ago and it was 99.1.
99.1. Okay, why don't we follow up tomorrow and day after and just give me a quick text if there's improvement. If there's no improvement, we'll see her again and then we'll consider going to the clinic. But for right now, I think I'm okay. Taste and smell, we know that we lose taste and smell with COVID-19 anyhow, and we know it comes back. So that's not, the biggest thing that we worry about is the breathing issues, which she's not really experiencing right now, which is excellent. But if she starts to feel anything like that, like there's a relapse, we need to know immediately because we'll probably want to take her to the hospital.
Okay, all right.
Okay? But right now, she looks pretty darn beautiful. Okay? No problem.
Okay.
Okay.
Right.
Okay. Haribol, done with round.
Send a book around, Haribol.
Okay.